Assalamualaikum and hi, we are from M1101J. My name is NURUL binti BUDI and my ID number is 2024964352.
My name is FATIN AUNI binti HANAFIAH and my ID number is 2024252512.
My name is Mohamad bin Mohamad FAIZAL and my ID number is 2024253744.
My name is SYAFIQAH binti ROSNI. My ID number is 2024680582.
My name is PUTRI binti Mohamad ZAMANI. My ID number is 2024629394.
Let's watch our videos.
Hi everyone, let's start our discussion with introduction. As we know, the COVID-19 pandemic reached in Malaysia in January 2020, bringing significant challenge. The Ministry of Health (MOH) worked urgently to manage the virus, support healthcare facilities and balance health measures with economy needs. Hospitals faced overwhelming demand for medical supply and staff, prompting the MOH to expand capacities and set up temporary treatment centers. Lockdown caused economic struggle, especially in tourism, retail and hospitality, leading to job closures and business closure. The government provided financial aid and support program to help those affected. Strict lockdown also impact mental health, causing stress, anxiety and disrupted daily life, especially for children and family due to school closure and limited social activities.
Chapter 2, Managing the Issue, which is planning. Introduction of planning is essential for achieving any goal. It involves setting objectives, creating strategies and organizing activities. For the COVID-19 outbreaks, the Ministry of Health (MOH) developed a detailed plan to manage the situation effectively. The planning by the Ministry of Health (MOH). First, preparedness by MOH. The MOH implement key measures to prepare for COVID-19, which is screening was improved at airport and seaports. Second, testing was expand to clinics and hospitals. Second, strengthening public health is to improve public health. First, contact tracing and case identification were enhanced. Second, suppliers of personal protective equipment (PPE) and medicine were maintained. Third, control measure, which is target lockdown or EMCO, were enforced in high-risk areas and strict movement restriction were imposed to stop the spread. Second, technology also play a key role with apps like MySejahtera and MyTrace, making contact tracing and monitoring more efficient. Lastly, quarantine and isolation. To ensure safety, first 409 quarantine centers were set up for traveller and close contact. Second, a 40-day quarantine and dual PCR testing help detect cases early. This approach reduces local transmission significantly.
For Chapter 3, which is managing the issue in terms of organizing, the Malaysia's Ministry of Health (MOH) used a multi-pronged approach. They led the effort, but they didn't do it alone. They worked closely with other government agencies, businesses and community groups to create a strong response. So here's what MOH did. The Central State Coordination, the National Security Council and NCB provided overall direction, while the MOH coordinated effort across different sectors. So the MOH closely monitored the situation, identified high-risk areas and tailored their response accordingly. MOH also set up special hospitals and treatment centers and developed clear guidelines for patient care. They promoted important measures like mask wearing, social distancing and good hygiene. So for those who disobey these rules will be fined. MOH also promotes important measures like a vaccination program to protect the population. So this vaccination program will be held in the MySejahtera application. So users who are identified in the MySejahtera app can use it to identify their day, date and time and location for their appointment. So the MOH used the technology as a help. The MySejahtera app was a key tool for identifying people who may have been exposed to the virus. The apps also can be used for scheduling and tracking the vaccination, so users who are vaccinated will get an e-certificate which they can use to enter some premises. So if they don't have it, so they are prohibited to enter any premise. They also provide a QR card for check-ins, so users have to check in every time they enter a premises so that they will mark the attendance. So let's say if they are affected in the virus, so the premise need to be shut down for a while for this infection.
The
The Malaysian Ministry of Health MOH played a crucial role in planning efficient disaster responses during the COVID-19 pandemic. The MOH decision-making approach was based on prompt information sharing, flexible public health interventions, and cross-sectoral cooperation. The MOH implemented press briefings, digital platforms, and incremental regulation to maintain public trust and ensure compliance with health directives. Data analytics were used to assess pathogen distribution trends, identify hotspots, and prioritize resource allocation. Community engagement was also vital, with community leaders and civil society organizations enhancing public health, messaging, and compliance.
I want to talk about controlling. The first one is the Malaysian government enforced the Movement Control Order, or we can call MCO, on March 18, 2020 to control COVID-19. It closed schools, non-essential business, and restrict movement and travel. The decision was based on rising local and global cases. Guided by the Ministry of Health, police enforced the rules, and regular updates kept the public informed. Later phases, like the conditional CMCO and recovery MCO (RMCO), adjust restrictions based on local conditions to ensure safety while gradually returning to normal life. Other than that, Malaysia's vaccination rollout was crucial in managing COVID-19. The National COVID-19 Immunization Program (PICK) prioritized healthcare workers, the elderly, and high-risk groups. The government secured vaccines like Pfizer, BioNTech, AstraZeneca, and Sinovac through global partnerships. Vaccination centers were set up nationwide, supported by a digital registration system. As the program expanded, younger population and essential workers were included. Public awareness campaigns address vaccine hesitancy, ensuring widespread protection.
End of our discussion. MOH shows strong leadership in managing COVID-19. MCO, the MySejahtera app, and expanded healthcare facilities help control the virus and reduce its impact. A SWOT analysis highlight MOH strengths such as quick action and technology use. However, challenges like healthcare worker burnout and economic pressure reveal weakness. Opportunity such as advancement in health technology and participation in global vaccine trial improve preparedness, but threats like new variants and dependent on international suppliers remain concern. Overall, the MOH effort protect public health and stability by addressing challenges and build on strength. Malaysia is better equipped to handle future crises with improved technology, resources, and public cooperation.